Hello, and thank you for watching. If you are preparing for surgery, it's normal to have questions. You may hear your care team mention Intraoperative Neuromonitoring, or IONM. IONM is a safe monitoring tool used during certain surgeries to help protect your nerves while you are asleep. Let's quickly walk through what it is and what you can expect. So, what is neuromonitoring? Neuromonitoring is a safe, painless, and widely used real-time method for your surgical team to keep an eye on your nervous system during surgery. Your nervous system includes your nerves, spinal cord, and brain, the pathways that help you move, feel, and function normally. During the operation, a specially trained expert called a neurophysiologist joins your team. Their job is to monitor these nerve signals in real time. And most importantly, IONM is painless, safe, and done only to add extra protection during your procedure. Why is IONM used, and how does it help you? One reason many hospitals use IONM is because it helps make surgery even safer. During certain procedures, nerves or the spinal cord may be close to the surgical area. IONM helps the team protect delicate nerves, detect changes early, reduce the risk of nerve injury. The neurophysiologist watches nerve signals throughout the entire surgery. If anything changes, they immediately alert the surgeon and anesthesia team, so adjustments can be made right away. Remember, this does not replace surgery, it simply adds another layer of safety and communication. So if your team recommends IONM, it's because they are taking extra steps to protect you. You may be wondering, how does this monitoring actually work? Depending on your surgery, your team may use different types of tests, all of which are commonly used and well understood. One method is called electromyography or EMG, which checks muscles to see if a nerve is being stretched, irritated, or at risk during surgery. Another is motor evoked potentials, or MEPs, where gentle stimulation helps confirm that movement signals from the brain are reaching the muscles normally. Somatosensory evoked potentials, or SSEPs, check pathways responsible for sensation by tracking signals from the arms or legs to the brain. And in some surgeries, electroencephalography or EEG may be used to measure brain activity, especially when monitoring blood flow or anesthesia depth. While the names may sound complex, these are safe tools that help your team watch over your nervous system during surgery. What happens before surgery? Before your surgery, the neurophysiologist will take a moment to meet with you. They'll have a quick, friendly chat to help you feel more at ease before heading into the operating room. During this conversation, they might review your medical history to better understand your background, explain the monitoring procedure so you're well informed, and answer any questions you have along the way. And one important thing to remember is, no monitoring process starts until you are completely asleep under anesthesia. What happens during surgery? Once you are asleep, small electrodes are placed on areas such as the scalp, arms, legs, or specific muscles. There is no need to worry, you won't feel these during the surgery. Throughout the procedure, your nerve pathways are continuously checked. If any changes appear, the monitoring team immediately notifies the surgeon, so they can respond right away. What may you notice after the surgery? After surgery, most patients do not notice any effects from neuromonitoring. However, depending on the type of monitoring that was used, you might notice mild soreness where stickers or needles were placed, small marks or redness from adhesive pads, in rare cases, mild muscle soreness from stimulation. These effects are temporary and normal, and typically resolve within hours. Very rarely, there might be minor scalp irritation or small bruising where the electrodes were placed. These effects are also temporary and usually heal very quickly. Overall, the biggest benefit of IONM is that it helps lower the risk of nerve or spinal cord injury and improves the chances of maintaining normal movement and sensation after surgery. So, don't worry, IONM is safe, commonly used, and is simply one more way your care team works to protect you. If you have any questions or concerns, your surgical team is always there to support you. Thank you for watching.